A 4-year-old boy is brought to the physician because of a swollen eye. His mother says he's also been reporting a headache. Physical examination shows a child with a generally unwell appearance, right eyelid edema, a slight bulging of the right orbit, and large amounts of mucopurulent discharge from his right nostril. Which of the following may be part of a procedure used in the treatment of this child? Choice A, entering through the valve of Hasner in the inferior meatus. Choice B, repairing the tissue in the medial portion of the piriform aperture. Choice C, entering the space behind the posterior portion of the superior meatus to access neuronal tissue. Choice D, accessing the semilunar hiatus in the middle meatus. Choice E, drainage of fluid from an opening in the nasopharynx. I'll wait 5 seconds and begin answering the question. So, step 1 occasionally likes asking these anatomy questions about the nasal cavity and its sinuses. I had a bit of fun when writing this question, and I threw in some really stupid, obscure anatomy here, because there's actually a couple NBME questions that are like this as well. But just like with a lot of other things on this exam, oftentimes they're not actually trying to test you of random, obscure sounding anatomy minutiae. So if you see questions like this and you get confused, let's just go back to the basic anatomy real quick, okay? You have the superior, middle, and inferior nasal conchas / turbinates. Concha and turbinate basically mean the same thing. They're this bony / fleshy protrusion, and you have a meatus under each one, which is basically just like a passage / empty space. The inferior meatus is the largest one, and it's usually the one you see when you first put a scope up somebody's nose. Okay? Now let's talk about the sinuses. You got the frontal sinus, which is basically between your eyebrows. You got the maxillary sinus, which is basically like just lateral to your nose. You got the ethmoid sinus, which is just medial to your eyes. So in a way you can kind of imagine the ethmoid sinus is kind of between the frontal and maxillary sinuses. And then in the very posterior of the nasal cavity, you have the sphenoid sinus. Now, every single one of these sinuses drain into the nasal cavity. The frontal, ethmoid, and maxillary sinuses all drain into the middle meatus via the hiatus semilunaris. The ethmoid sinus also drains into another part of the middle meatus, but that's not so important. And then finally, you have the posterior ethmoid sinus plus the sphenoid sinus, both draining into the appropriately named sphenoethmoidal recess. So that's not hard, right? So again, frontal, ethmoid, maxillary, all into middle meatus, sphenoid and ethmoid into superior meatus. And for 2 other things they want you to know about the nasal cavity, the nasal lacrimal duct drains into the inferior meatus, and the opening of the eustachian tube drains into the nasopharynx. For most questions, that's really all you gotta know. You gotta know superior, middle, inferior meatus. You have to know the sinuses, and you have to know where the sinuses drain. And finally, you have to know where the nasal lacrimal duct and the eustachian tube drain. For the majority of questions I've seen on the NBME, you don't need to know some stupid, obscure anatomical location, because mostly when they write one of those, they will make sure it also mentions a point that I just made. So as for conditions associated with each of these sinuses, obviously all of these sinuses can end up in some kind of meningitis if it gets bad enough, but the ones you tend to think about the most is that ethmoid sinus, it can cause eye symptoms because they're right next to the eye. The sphenoid sinus is what you think of when you think of like accessing the pituitary gland. The nasal lacrimal duct should be self-explanatory, and the eustachian tube, of course, connects to the middle ear. So obviously applies to common sense. So if they give you a patient with a bunch of eye symptoms, like they have exophthalmos or something, in addition to just general fever symptoms, you might think ethmoid sinus infection. If they give you a middle ear infection and then they say, oh, where do we need to drain from? Obviously that would be from the eustachian tube. So coming back to this question, we got a kid with a headache, a swollen eye, and discharge from his nose, and also I describe exophthalmos. So I make it pretty clear that this is an ethmoiditis. And then I just turned the answer choices into an anatomy question, right? So obviously, if I wanted to drain from the ethmoid sinus, well, I could drain from both the middle and superior meatuses, right? Because like I just described, the ethmoid sinus can drain into both of those. So we just have to find the answer choice that describes that. And in this case, it's obviously choice D, accessing the semilunar hiatus in the middle meatus. So if you look at the other answer choices here, I kind of wrote them in a way that even if you don't know some obscure anatomical detail that I threw in there, the general location of it should kind of help you pinpoint what I'm talking about. So for example, choice A, entering through the valve of Hasner in the inferior meatus. Well, maybe you don't know what the hell the valve of Hasner is, but you do know the nasolacrimal duct opens in the inferior meatus. And in fact, the valve of Hasner is one of the valves in the nasolacrimal duct. Choice B, repairing the tissue in the medial portion of the piriform aperture. This is just me throwing in some complete nonsense. The piriform aperture is just kind of like the general shape of the nasal cavity from a frontal view. Not that important, but I throw it in here because one of the NBMEs has an answer choice that kind of looks like this. Obviously thrown in there as some weird distractor to get students confused. Choice C, entering a space behind the posterior portion of the superior meatus to access neuronal tissue. Now, since I wrote this question as an ethmoid sinus question, I was very careful to write the answer choice with the superior meatus in it, so that you don't get confused into thinking that I'm talking about draining from the superior meatus, which of course is something you can do with the ethmoid sinus. But I wrote it very clearly to be accessing the sphenoid sinus specifically, so you can excise a pituitary adenoma or whatever. Choice E, drainage of fluid from an opening in nasopharynx. Obviously this is the eustachian tube, so this might be something you would do for a middle ear infection. So bring it back. Once again, if you get one of these nasal anatomy questions, don't get intimidated by the question writers throwing some stupid, obscure anatomy at you. Fall back on your basics of what you know about the nasal cavity and try to answer the question that way. I hope this video was helpful. I'll see you in the next one.